is Tashanna, and we are discussing postpartum depression, and I also went through postpartum depression after I had my first daughter. I noticed while I was pregnant, I noticed, things were different. I was feeling different, experiencing different things that were not so common for me. And it got worse. It got worse. What's the word I'm looking for? It presented itself more as the baby was born and as being through new motherhood, infant baby. As it progressed in that, I realized I wasn't feeling better. It wasn't getting better. Things were feeling much more difficult. Right. So as the baby got bigger and motherhood progressed, things were difficult. It was hard. Felt like I didn't know what I was doing. I felt like nothing I was doing was ever effective. I felt really shitty about myself majority of the time, and I just progressed and keep going and keep going and keep going. And eventually I had to take a minute and reflect on the things that I was feeling in comparison to how I would usually feel outside of pregnancy and the hormones and all of that, and come to a conclusion that I needed to seek help. So that's what I did. So after coming to the conclusion that I was indeed going through some stuff, I went to my gynecologist. I went to my first gynecologist. She told me it was just baby blues. Don't worry about it. You'll get over it. Went to a second gynecologist. Basically the same thing. Don't worry about it. These are just your hormones balancing and this and that and the third and the lack of sleep, and you're going to be fine. Don't worry about it. Time is continuously going on, and I'm not feeling better at any point. So I went to my house doctor, explained to my house doctor what I was feeling, all my signs, all my symptoms, told him what the both gynecologists told me, and he gave me a referral to go seek professional help with a psychologist.
Well, what happened with a psychologist?
You have to find a psychologist. You have to go through the motions of getting your letters and going. Sometimes you even have to go by SZV to get these things authorized before you can even attempt to talk to a psychologist. And you have to find a psychologist that you're going to feel comfortable with, to be as open and as honest as you can be for the process. And that took some time. So that probably took about, let me say, about 2 months in between getting the referral letter and actually sitting down with a psychologist. That took about a month and a half. And so we started having our sessions, and it started off 6 sessions, and then the 6 sessions progressed to 10 sessions, and the 10 sessions went back down to 6 went back up to 10, and it's been continuously 10.
Okay. And how are you now? How are things going with you now?
You have good days. You have good days and you have bad days, but it's how you manage it. It's how I manage it. So instead of always focusing on the things that don't make me feel good, or the things that I feel like I'm not accomplishing or not flourishing in as well as I expect me to, I take the time to reflect on the things that I'm doing good, on the things that I'm flourishing with, on the things that the now child is doing and able to accomplish on her own, the things I'm able to teach her. And it makes the good days good, and it makes the bad days a little less bad.
Last words.
So last words would be to the new moms, to moms who ain't so new, to people who have new moms in their lives, and they can see a difference in their behavior, in the way they react to certain things, just their daily movement. If you see something, say something. If you feel funny about something, go to your doctor. It might take a couple of tries. Lord knows it's going to take a couple of tries, but try not to give up. If you know you feel a way, you know yourself, and because you know yourself, you have to trust in yourself that I know the situation that I'm in right now isn't where I'm supposed to be. I need to get help. Initially, you're going to always want to try to figure it out on your own, and just boss through and push through it, and you're going to make yourself feel better. And that's a great approach until you realize that it's not working and things aren't changing. So if you need help, get help. Don't be afraid to ask for help. Don't be afraid to reach out to somebody, anybody, even if it's not initially your first contact isn't a medical professional or any type of professional, even if you just speak to a friend or a cousin or whomever, talk to somebody. Don't keep it to yourself. Don't bottle it.